strokes account for about 85% of all the strokes that occur. The next stroke is a hemorrhagic stroke. It occurs when the blood vessels break and blood leaks or spills into the brain tissue. Brain cells in that affected area die. And 15% of all strokes are hemorrhagic strokes. Right here we have stroke minutes. A lot of times you'll have patients that are being admitted to the hospital and they think they're actually strokes, but they're really not. A lot of times they present with some of the same symptoms as someone with a stroke might present with. The first one is toxic metabolic syndromes. This bases conditions, cluster conditions that can lead to strokes such as diabetes, coronary artery disease, increased blood pressure, high blood sugar, excess body fat, and abnormal cholesterol levels. For seizure disorders, individuals that have epilepsy sometimes might come in with looking as if they had a stroke. And also hemorrhagic stroke people are at risk of having more seizures as well. Migraine headaches, a lot of times people might come in saying they have had the worst headache ever. And a lot of times they end up having like visual disturbances, so that's one reason why they might think they've had a stroke. Degenerative neurological conditions such as Parkinson's disease, things like that, sometimes they might have some of those same symptoms. Brain tumor, a lot of times if you have a mass in your head that's pressing on certain areas of the brain, it can cause you to have those symptoms in that area, like the slurred speech or blurred vision. And also drug toxicity. This can be an intentional or unintentional overdose of drugs such as heroin, meth, and cocaine. And sometimes even prescription drugs overdose can cause those as well. So do any of you know any of the risk factors for a stroke? High blood pressure. Okay. And that's one of the main ones. So for risk factors of strokes, you have non-modifiable and modifiable risk factors. Non-modifiable risk factors are risk factors that cannot be changed no matter what you do. So you have age, sex, race and ethnicity, and genetic factors. For age, people over the age 55 and older are at a higher risk of having a stroke than other people. For sex, men are at a higher risk of stroke than women. However, women are usually older when they have a stroke, and they're more likely to die from stroke than men. And you might ask yourself, why are older women more at risk for having a stroke? That's because of the hormones. They're starting to have decreased estrogen production, and decreased estrogen increases your risk for cardiovascular events such as heart attacks and strokes. Race, African Americans are at a higher risk of having strokes than any other race. And genetic factors like having a previous stroke or having immediate family members that have diabetes or have had a stroke puts you at a greater risk for having a stroke. And I want to also mention this with, a lot of people have actual sex change procedures done. So just because you have a sex change procedure done, if you're male and you change yourself to a woman, it doesn't matter because your genetics automatically still show that you are a male, so they still have the same risk. Other risk factors for stroke that are modifiable are hypertension, obesity, smoking, unhealthy diet, sedentary lifestyle, which would be like not being active, and alcohol consumption. So do anyone know some of the signs and symptoms of a stroke? You mentioned earlier, the drooping of the face. Anyone know any other signs and symptoms of a stroke? I'm gonna give you somebody if you got to. Who said slurred speech? Okay. So some of the signs and symptoms of a stroke are sudden weakness, having paralysis or inability to move, or numbness of the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, problems breathing, dizziness, trouble walking, loss of balance or coordination, and unexplained falls, loss of consciousness, and severe and sudden headache. So does anyone know what BFAST stands for?
It was.
Okay, so basically, BFAST is a quick assessment that you as PCTs or anyone else can do. So what it is, you notice certain symptoms and everything, and these people are potentially have had a stroke. The B stands for balance, E stands for eyes, F stands for face, A for arms, S for speech, and T is for time. So with balance, having loss of balance, headache, or dizziness. Like we did earlier, we spun her around and she was off balance. E is for eyes. You may have blurred vision, double vision, or trouble seeing out of one or both eyes. F is for face, having one side of the face that is drooping. A lot of times we ask a patient to smile, and when they smile, you will see that drooping on one side of their face. A is for arms. You know, they have their arm weakness. They're not able to lift their arm, or if you lift their arm, it's flaccid and it just plops down, so they don't have any muscle to control it. And S is for speech. They're having trouble speaking or also trouble understanding what you're saying. And T is for time. Time is of the essence whenever you have a stroke patient, because like earlier I told you about TPA, it's a 3 to a 4.5 hour window when a patient can receive that drug medication. And also here at Baptist South, what you're gonna do, if you notice that any of your patients are having a stroke, the number to dial is 88888, 5 8s. And right here, I'm gonna just show you this picture. This is a little lady who's had a stroke. As you can see, I'm going this side. Right here, it's kind of blurry, but you can see the age lines right here on this side, whereas on this side, it's flat. Even with the nasal fold, you can see a definite fold right here, and right here on this side, you don't see it as much. And with the mouth, her mouth right here, and it's drooping down right there. So those are some of the things you will see with patients who've had a stroke. So what happens after a stroke? Patient can have aphasia. They may need diet modification exercise. They may have mental disorders such as depression, memory loss, paralysis, and spasticity, neglect, pain, PBA, sexual dysfunction, and vascular dementia. I'm going to only highlight on 3 of those.
Can you explain aphasia?
Yes, aphasia, mental disorders, and the PBA. So with aphasia is when someone have trouble expressing themselves, understanding what is being said to them, or a combination of both. For mental disorders, I would like to talk about depression. One thing with people who have a stroke, you know, they're normally people that are able to cook for themselves, feed themselves, dress themselves, basically do everything in their life by themselves. And now all of a sudden they have this weakness. They're not able to do those things for themselves. They have to depend on nursing staff, family members to do the simple things, just as even feeding them or cleaning them when they soil themselves. So that can cause a lot of depression, as well as not being able to communicate themselves to everyone. Because one of the things that we always notice is, you know, they have that difficulty trying to get their words out, and then when you're talking to them, they get frustrated because you're not understanding what they're saying. And then PBA is the pseudobulbar effect. It's a condition that causes uncontrollable crying or laughing. A lot of times a person may laugh when they're not even amused, or just start crying when they're not even sad. And I'm going to show just a quick video of the pseudobulbar effect. And a lot of you probably seen the commercial. I think it's Danny Glover on the commercial, and he's just showing, you know, how people just laugh for no reason or crying for no reason.
That's a current commercial that's on TV.
Have you ever seen someone laugh during an inappropriate situation? Or cried? uncontrollably longer than they needed to? Have you ever seen yourself do this? People who suddenly and uncontrollably laugh or cry may have PBA, pseudobulbar effect. It's a neurological condition. PBA and depression, while easily confused, are two different conditions. Distinguishing the two is simple. Depression starts with an internal emotion, such as sadness. That emotion will then become an external expression, which is often crying. PBA, on the other hand, is a sudden burst of emotion that may not match an internal emotion. These outbursts are uncontrollable. Each episode can last seconds to minutes at a time. Some tips for people with PBA. Be open and let people know that you have a condition that sometimes prevents you from controlling your emotions. Change body position. It is important to note postures when you have an episode. Distract yourself. Focus on something else. And be sure to breathe and relax. Try to release the tension in your muscles that builds during a PBA episode. For more information about PBA, visit us at stroke.org/PBA.
So for stroke prevention, there are certain things that you can do to prevent strokes. For healthy diet, eating a diet that contains 5 or more daily servings of fruits and vegetables may reduce your risk of stroke. Healthy weight, being overweight contributes to stroke risk factors such as high blood pressure, cardiovascular disease, and diabetes. Physically active, exercise can lower your blood pressure, increase your good levels of cholesterol, improve overall health of your blood vessels in the heart. It can help you lose weight and control your diabetes. Smoking cigarettes, and even having secondhand smoke are major risk factors for stroke. So quitting tobacco reduces your risk of stroke. Limit alcohol use. Heavy alcohol use consumption can increase your risk for high blood pressure, ischemic strokes, and hemorrhagic strokes. And prevent and manage your health conditions. So managing blood pressure is one of the most important things that you can do that can reduce your risk of stroke. Eating less cholesterol in your fats, especially saturated fat and trans fat, may reduce the buildup of arteries in your arteries. Diet, exercise, and losing weight can keep your blood sugar in a healthy range. And also, like doing drugs, cocaine abuse. Believe it or not, we have a lot of patients that come into the hospital who've had like hemorrhagic strokes because of cocaine, because it causes a very high blood pressure and it causes them to have a stroke. So for stroke treatment, you have treatment for both ischemic and hemorrhagic stroke. For ischemic strokes, like I said, you can receive a TPA, which is a blood clot busting medication that can prevent further brain damage. And you can have mechanical thrombectomy, which is when the doctors go in and extract the clot. For hemorrhagic strokes, you have mechanical treatment and surgical intervention. Doctors go in and they cap the vessels so that the bleeding can stop. So stroke rehab, basic first stroke rehab is to help stroke patients relearn skills that are lost when part of the brain is damaged. So you may wonder, what is your responsibility? As a PCT, you are to get vital signs every 4 hours unless specified and as needed. You are to assist the patient with their nutrition, feeding them if needed, setting up their meals for them, and also the 5 P's, which are pain, personal hygiene, positioning, presence, and possessions. When you're doing your out and round, you need to always address those 5 P's when you're in the room. When you're talking to the patient, you want to position yourself directly in front of the patient and make eye contact. You want to report any changes of physical, emotional, or mental conditions to the nursing staff, and activate rapid response team as needed. Like I said, if you come in there and you see something different with the patient from what was earlier, you need to always dial 88888. And document care, vital signs, and any notifications to staff. This is one thing I know they've been drilling into you all, like whenever you do have an abnormal blood pressure, you document, they always say to add a comment or flag will come in. You wanna put whatever that abnormal vital sign is, as well as who you notified. You don't just put notified nurse, you always wanna put that name with that nurse so they know that you did what you're supposed to do. So the role of the PCT when caring for a stroke patient, like I said, you play an important role in the rehabilitation of a stroke patient. You will help with position changes, and that can go from actually changing the patient, for turning the patient yourself because they're unable to, assisting the patient to turn, or even encourage patients who can turn themselves every 2 hours. You can assist in activities of daily living, such as feeding, dressing, bathing, elimination needs, and ambulation. And ambulation is key when caring for those patients, so you always want to talk with your nurse to see what the patient can do first. Like earlier, I saw y'all using the gait belts. You know, that's good to do, but you also just want to make sure that patient is able to get out of bed, or to know if you need one other person to assist you with that patient as well. So some of the safety measures when caring for a stroke patient, you have aspiration precautions, fall precautions, seizure precautions, skin precautions, UTI, urinary tract infection, VTE prophylaxis, patient positions, early mobilization, elimination, and nutrition.
Can you talk about, there's 2 or 3 things up there. The first one, can you tell us more about aspiration precautions?
Yes.
Oh, you're actually gonna go on that.
Know what aspiration
Sorry about that.
means. Okay, aspiration is the breathing of foreign objects into the airway. You have 2 different types of aspiration. You have large particle and small particle. With large particles can obstruct the major airways, causing immediate asphyxiation and death of the lungs. And to remove those, you do a bronchoscopy to remove those large particles. For small particle aspiration, it can cause severe inflammatory reaction in the lungs, which can lead to pulmonary hemorrhaging, which basically means that the tissue of the lungs are starting to hemorrhage and bleed. If food is acidic, it can cause pulmonary necrosis, which means that your lung parts are basically starting to die. And then you have food that contains bacteria, sometimes can lead to the patient getting pneumonia. So in treating aspiration, aspiration, it is a swallowing dysfunction, which is a frequent complication of a stroke. Patients who have had or who are suspected of having a stroke are placed on NPO, which means nothing by mouth until a swallow test is conducted by the nurse. A lot of times we might do a swallow screen on the patient and they fail. So we just don't give them anything and we'll wait till that speech therapy comes, which they're normally ordered for all stroke patients. So they'll come and check to see if the patient is having trouble swallowing and to see if they need to possibly get like an NG tube or something like that for their nutrition. So some of the signs and symptoms, aspiration, you're gonna have lung issues such as trouble breathing. They may have a fast heart rate, and you're gonna hear sounds just on hearing that shows like buildup of fluids in the lung. A lot of times the patient will have low oxygen levels, they will have decline in their functional status, and have some delirium. Like you'll notice that they have some confusion that's going on. So how can you prevent aspiration? You can prevent aspiration by providing oral feedings only when the patient is alert and awake. If they're drowsy and sleepy, don't try to feed them anything. You want to supervise feeding with an inspection of the oral cavity. That is, like while feeding, you just want to look into their mouth to see if they're actually swallowing, chewing and swallowing their food. Because a lot of times you'll have patients, you think they're chewing and swallowing, but what they're actually doing is packing it back there inside, and that can cause a problem because, you know, if they're not fully chewing it and maybe they might fall asleep and that can go down, they can aspirate on that. You want to keep the head of the bed elevated at least 35 to 45 degrees when feeding your patient. You want to flex their head slightly downward with each swallow. You want to avoid any rush or forced feedings. Don't try to, like, you know, you're trying to, I know sometimes, you know, it might get a little hectic, you might have more than one patient to feed, but you don't want to try to rush through it, just trying to hurry up, because that can cause problems. You want to use thickened liquids or the pureed diet. A lot of times you're going to have patients who have problems swallowing thin liquids, so speech therapy is going to recommend thickened liquids. So those, it's a little package. If you haven't seen, you just pour the pack into their juice or whatever, stir it up, and it causes it to have like a thick consistency, and that can help them swallow. And then you have the puree diet, of course, like baby food, just blend it up. You wanna provide frequent oral care to the patients, and when you're providing care to a patient that's on the continuous tube feeding, you always wanna get the nurse to come and press hold on that for you before you lower the head. Cause when you're on a tube feeding, you have to be at least 35 degrees head of bed up. So you want them to come hold it, because if you lower it while it's still going, that can cause them to aspirate as well. Fall precautions, here at Baptist, we're big on fall precautions. So, patients with a stroke are at a high risk for a fall due to periodic limbs, alteration in sensation, and alteration in cognition. Okay. So here at Baptist Southview or any other Baptist facilities, well, if you have a patient that's a fall risk, you're gonna see a sign on that door with the falling star that's indicated that patient is a fall risk. For patients who are a fall risk and have a fall score of 6 or greater, you wanna make sure that patient has a fall armband, yellow socks, and a yellow gown on. And the fall score is done by the nurse at the beginning of each shift, and it can be found in IVU. So how can you prevent falls? You wanna make sure that you familiarize the patient with the environment. You want to educate the patient on the importance of the use of the call light, because a lot of times, patients don't want to be bothered, don't want to bother you. They want to try to get up themselves. You want to always tell them it's important for them to press that call light before getting up, so you can come assist them. You want to make sure your bed is in low position. You want to keep the brakes locked. You want to use the non-slip socks for those patients, help them with the grip. You want to keep your floor surfaces dry and clean. And you want to keep the patient care areas uncluttered. You want your bedside rails to be up ×3, and you want to use the gate belt. Like I said earlier, for patients who have a fall score of 6 or greater, you also want to make sure you have the bed alarm on. I prefer for you all to put it on the second one, because like if it's on the first one, if it goes off, by the time you get there, patient already up. But if it's on the second one, as they start to move around in the bed, like that motion to get up, it'll alarm at the nurse station, so you can get there before they're actually up.
So there's different levels you can set the bed?
Yes, ma'am, it's three sensitivity levels. And then also you want to make sure that the blackjack is hooked up to the bed. The reason why you want to make sure that the blackjack is hooked up to the bed, so when it'll alarm at the nurse's station as well. And that way everyone will know which room is being alarming.
Y'all will see the blackjack when you get in your clinical rotation.
The next thing is seizure precautions. Patients who have suffered from intracranial hemorrhage are at a high risk of seizure activity. The location of the hemorrhage may affect the likelihood of a seizure occurring. On my floor, we have what we call seizure pads. We have, I think, 2 or 3 sets of these, and what we do, we put the pad on each rail. So if the patient starts to have a seizure and they're moving around, they can hit the pad and won't hurt themselves on the rail. A lot of floors may or may not have them, but if you don't have it, what you can do is get a blanket and tape it around the rail, so the patient does start to have a seizure and start moving around in the bed, they won't hurt themselves.